Hi, welcome back to my channel. I'm Francine. And for those of you that are new and you want to follow me on my breast cancer journey, hit the like and subscribe button. And I'm glad you're here. Today I just wanted to talk to you about this next step in my cancer journey. I am supposed to start chemo on Tuesday, and actually it's about midnight on Monday midnight, and I've been feeling pretty anxious about everything. I do not want to be sick, and that is for sure. And also, I don't want to lose my hair, which they said that takes about 17 days for it to fall out. I'm just now getting used to it. So anyway, I'll just enjoy it while I have it. Okay, so I want to talk about the chemo teaching that I had. Like we knew that we were gonna have to go through chemo. We knew that I was gonna have to go through chemo. So, and basically, all you really know is that you're gonna be sick and you're gonna lose your hair. So when I went through my chemo teaching, I guess I was expecting a little more. I don't feel like she was very thorough in her explanation of what I was supposed to expect, but I guess she did the best she could, or she just felt like she didn't want to scare me half to death. So when we got home, my children wanted to know about it, so we read about it. So I'm going to be on 2 medications. In the beginning, it's going to be adriamycin and Cytoxan. So those 2 drugs combination. And I'm going to do those starting Tuesday, April 9th. I'm going to do that every other week for 2 months. So twice a month. Twice in April and twice in May. And then I'll switch to Taxol, and then I'll be doing that every week for 3 months. If my body is okay to do it, then that'll be the schedule. So, about this adriamycin and Cytoxan, I have the papers. I'll tell you a little bit about it. So that's what I plan to do. And I'm not going to go into everything, but it is daunting. So the possible side effects of adriamycin is bone marrow depression. This is a decrease in the number of white blood cells and red blood cells and platelets. And they say this may raise your risk of infection or make you tired and weak and fatigued and raise your risk of bleeding. So we know that white blood cells help you fight infection, and that's in your bone. Your bone marrow makes the white blood cells, and then your red blood cells makes, I think it's like carries your oxygen to your blood, hemoglobin, whatever, and that's supposed to help you, and with your iron, and so it's supposed to make you, I don't know. So anyway, your platelets stop you from bleeding, basically. Clot your blood. So anyway, fever in the setting of decreased white blood cells, which is a serious condition that can be life-threatening. Tiredness and weakness, general discomfort. I'll do it like this. That's backwards. General discomfort, a feeling of being unwell, blurred vision, hair loss. It says it's temporary. I'm going to lose my hair. Oh. Anyway. But it says hair loss may happen suddenly or gradually. If you lose hair, you may lose it from your head, face, armpits, pubic area, chest, and or legs. You may also notice your hair getting thin. It changes in your nail color or nail loss and or brittle nail. Nausea and throwing up, vomiting, or diarrhea, decreased appetite, decreased hunger, soreness in the mouth and throat. Hey dear admin, I told you it was midnight. Allergic reaction, And it says, in women, menstrual bleeding may become irregular or stop while getting this drug. And women may go through signs of menopause and have vaginal dryness or I ain't gonna say all that. Dryness or itching. Yes, say vaginal dryness or itching. Oh, Lord. We got to get something for that just in case. We ain't on that. That's some bull. We are not doing that, okay? The devil. I bind every one of these side effects in the name of Jesus. Don't even touch my body. And then, so those were possible side effects, and it says not all possible side effects are included. And then you go to warning and precautions, and it says skin and tissue irritation, changes in the tissue of the heart, or congestive heart failure. It may raise your risk of getting a second cancer, such as leukemia, severe bone marrow depression. I'm just telling you what it says. And then it says important information: this drug may present in the saliva, tears, sweat, urine, stool, vomit, semen, vaginal secretion. Yeah. And the urine, it can change your urine color. Then it gives you all the stuff to treat the side effects. But anyway, that was the Adriamycin one. And this one I'm going to be starting out with this one and the Cytoxan, both of them. And so that's the AC treatment. And the possible side effects for this, the Cytoxan, is a decrease in the number of white blood cells, which raise your risk of infection, fever in the setting of decreased white blood cells, which is a serious condition that can be life-threatening, nausea and vomiting, loose bowel movements or diarrhea or hair loss. And it says all the same areas. And so then it's warnings and precautions is severe bone marrow depression, abnormal heartbeat or changes in the tissue of the heart. And with that heart thing, they gave me an echo. I did an echocardiogram, and I guess that was just to get a baseline of my heart. And if something goes wrong, it has something to kind of measure it by. It could be changes in your liver function, blockage of small veins in the liver, which can cause liver failure, and that's life-threatening, inflammation or swelling of the lungs, and change to small vessel of your lungs. This drug may cause slow wound healing. So that's what like if you get a wound, it heals slow. Electrolyte changes can raise your risk of getting a second cancer, and the side effects may be more severe if you are receiving high doses of medication. So, needless to say, that does not sound fun. But I am hopeful that God can just allow me to, some of those things not to be as bad. And I know they give pre-meds, they give steroid and nausea and vomiting medication before you do your treatment. So that's supposedly supposed to stop a lot of those symptoms. And the nurse said, if anything happened, call. If you got a problem, call. If you think something is off, call. And so I guess they want me to call. So that's what I'm going to do. I'm going to call them. They're going to hear from me. So anyway, last but not least, the last medication is Neulasta. And I'll get that a day after treatment. And so Neulasta, I guess, is supposed to helps your body make more white blood cells. So these medications, the side effect is that it's going to decrease your white blood cells to stop you. That causes you to, white blood cells causes you to fight infections. So this one is supposed to help increase white blood cells and help fight infections in your body. And so it's given under your skin, like subcutaneously. And so now I guess they don't just give you an injection. They put something on the back of your arm or on your abdomen, and it the way the lady explained it is like it pokes you, the needle pokes you and inserts the catheter, and then 27 hours after your treatment, it automatically gives you this medication over 45 minutes. That's something I didn't know, so that has to be fairly new. I haven't worked, I was a pharmacy technician, but I haven't worked in a pharmacy for about 3 years. I think it'd be 3 years this month, so that has to be something new. I don't know if it was within the last 3 years. But anyway, and that side effects is bone pain and pain in your arms or legs. And it's a lot of other side effects that could happen. And so if you're in pain, call your doctor. Whatever, just call your doctor. So I just believe God that he's going to get me through this and see me through this. And I just want to get it over with. Basically, that's where I'm at. I don't want to be sick. And then I do childcare at home. I'm a type B childcare provider. And I was just keeping kids on the weekend. On that Saturday, I've been keeping kids ever since this happened. That's basically, my other children just basically stopped coming in February. But up until that point, I was keeping, I think, like 9. I had like 9 or 10 children. So now I have 4. And I keep them on Saturday. So I just was going to do that if I could. But I think I'm going to try to keep kids. I don't want to just lay down and die. I want to keep moving and doing whatever I can, when I can. If I'm tired, if I'm not feeling well, I will lay down. But up until that point, I'm going to do whatever I can. I ain't oh, he said not lay down and die, lay down and roll over. I don't know. But I just plan to do whatever I need to do to survive. And I believe that believing God is a major point, and just having faith. I think that your mindset is very important in this process. If you think that you're going to die and you just give up, I think that you'll give up, and you basically will. Your body will follow suit. So I try to keep myself upbeat, happy as possible. Me and my husband, we stay laughing, and sometimes I clown him and he do the same with me, and we just enjoy each other. And we knew that this time was coming, so we like took a little trip out of town, and like tonight we went to the comedy show. So saw Gary Owens. He was funny. So that's basically it. We just trying to get through this. Like I was saying today at church, I don't want to be negative. I don't want to be bitter. I don't want to be down. I don't want to be depressed. I want to be still maintaining the testimony of our Lord. So that's where I'm at. Okay. All right. Well, I guess that's it. I just wanted to talk about what's going to be happening to me. And then, so I'll do another video on my way to treatment and how I'm feeling that day. So that'll be on Tuesday. And then after treatment, I'll do another little video, whether I feel like it or not. I am going to make myself do a video on the way home. And then I'll do one like later in the day just to kind of give a little diary of how I'm feeling. So I'm just keep me in your prayers. I'm not like doing a video and then going back like years later to put it online. I'm like doing it in real time. So, and I don't always do videos because like sometimes I don't feel like it or I want to, and then my hair don't be looking right. So I don't know what I'm gonna do when the hair fall out. And I don't like wigs because they look like wigs. So if I could get somebody, I'm trying to find somebody to make me a wig. If anybody, I'm in Toledo, Ohio. I need a wig that looks like hair and not like you just put a big mop on your head. You know what I'm saying? No. I don't got nothing against mops, but I don't want one on my head, okay? So I got standards. or I'm just gonna wear a hat. So, okay, well, that's all. Like I said, if you like the video, I would appreciate it. If you want to subscribe and follow me, that'd be cool as well. And then I'll see you next time.